I'm Martina Tierney, Occupational Therapist and Clinical Director at Seating Matters. In the short video that follows, we're going to talk about posture and the effect that poor sitting has on posture. Posture can kill. It sounds very extreme. You'll never see it written on a death certificate, cause of death posture. But if you think of your client and how they've sat for their weeks, months, years leading up to their death, in some way posture has contributed to their death. So what is good posture? Good posture or normal posture is when the pelvis is sitting level, the weight is taken evenly through both ITs, the spine is in midline and the head is balanced equally above the hips. This is a very efficient posture and very easy to maintain. However, most of the clients we deal with on a day-to-day basis do not show normal or correct posture. This is due to their physiological condition or their neurological condition. Some of the complications that would be directly linked to poor posture could be inability to breathe properly, so it affects the respiration, inability to digest their food properly, so it affects their ability to eat properly. Also, pressure ulcers is one of the big things. Research shows that 13 out of 100 people who develop a grade 3 or 4 pressure ulcer will die within 1 year of discharge from hospital. As we know, 95% of all pressure ulcers are avoidable, so it's very important that we understand the link between seating and pressure ulcer development. So what are our goals for seating? The goals for seating can be divided into 3 categories: physiological goals, psychological goals, and functional goals. During the research carried out by Ulster University on Seating Matters, we found an improvement in all these areas. We saw an increase in physiological functioning, we saw an improvement in functional tasks, and a major reduction in pressure ulcers. In seating, the pelvis is the key, and it's very important that you locate the pelvis and that you're not afraid to touch the pelvis and feel the position of the pelvis. The key things on the pelvis are, at the front we have the 2 ASIS. At the back we have the PSIS. And this is the beginning and the end of the iliac crest. Then we have the ITs or the ischial tuberosities. In normal sitting, the weight is taken evenly through both ITs. The pelvis is usually in a minimal anterior tilt, and the ASIS and the PSIS are level. So what prevents someone from maintaining this normal or correct posture? And the answer is gravity. Gravity is continually working against us, and with our clients they have an inability to hold themselves upright against gravity, and this will then result in abnormal postures. So the first posture that is very commonly seen is posterior pelvic tilt. And this is where the pelvis is tilted backwards. The ASIS are higher than the PSIS. The weight is going through the sacrum, which is a very vulnerable area and at high risk of pressure ulcers. When we're considering why someone sits in a posterior pelvic tilt, we have to think of the clinical reasons and we have to think about the technical reasons, how the chair itself is causing the posterior pelvic tilt. The next posture is anterior pelvic tilt, and this is where the pelvis is tilted forward. The ASIS are lower than the PSIS, and at this time the weight is taken through the pubic region, which is at high risk of pressure ulcers. A very common posture that we see a lot is pelvic obliquity, and this is where the pelvis is tilted to one side and the weight is going through one IT. This is usually caused by instability of the person or instability of the chair. The fourth posture that I want to talk about is pelvic rotation. And when we look at a pelvis that's rotated, one ASIS is forward and the other is back. We usually note it because there's usually a leg length discrepancy. When carrying out a seating assessment, we need to consider the 3 spinal presentations. lordosis, scoliosis and kyphosis. Lordosis is usually associated with anterior pelvic tilt. It can be caused by tight hip flexors. It can be caused by weakened abdominal muscles relative to the extensor muscles, and people with a lordosis usually complain of back pain. Scoliosis is usually associated with a pelvic obliquity. It can be C-shaped or S-shaped, and it's important that we establish if it's a fixed or partially correctable or correctable posture. Clients with kyphosis usually display a posterior pelvic tilt. This is like a humpback in the upper thoracic region. We need to establish again if it's a fixed posture, is it correctable or partially correctable. It reduces physiological function and needs to be accommodated in seating. When considering these postures, we need to establish the cause of the posture so that we can find a seating solution. We also need to establish if the posture is fixed, partially correctable or correctable. One of the main contributory factors is tight hamstrings. When we're doing a seating assessment, we need to learn how to accommodate hamstrings within seating. This is an area that is commonly overlooked and has a big impact on how to seat someone properly. Accommodating tight hamstrings in seating is something that I'm very passionate about and something that I would like to do a full video on. If you think this video would be useful, just leave us a comment below. If you would like help with seating assessments, we have seating specialists in your area who have been trained by myself at Seating Matters. You could also order a free copy of the Clinician Seating Handbook. This is the only available publication worldwide. Thank you for watching this video. If you found it useful, share, like and subscribe to our YouTube channel.